Hello people, in this video we want to cover burns. So basically what is burn? It's a type of coagulative necrosis. Do you know the type of necrosis, guys? Burns is a coagulative necrosis. So if you remember in pathology you have studied that coagulative necrosis is the most common type of necrosis, okay? It's the most common, guys. So basically because of some irreversible injury, okay, there is stoppage of blood flow, ischemic necrosis, or because of some chemical agent or bacterial agent, okay. So this happens mostly in the heart, kidney, spleen. These are the common organs. So they are showing here the coagulative necrosis in kidney. Here they are showing, okay. So here you can see the necrotic tissue, okay. Intensely eosinophilic cytoplasm. So the cytoplasm is very pink, is it? The outline of tubules are still maintained. So this is the kidney, so tubules, okay. So what will you see grossly in coagulative necrosis? You will see pale, firm, slightly swollen. Okay, you're calling it as an infarct, the focus. Okay, and as it progresses, the area will become yellow, softer and shrunken. Microscopically, you will see tombstones. Tombstones you will see. Okay, so tombstones you will see in coagulative necrosis. See, they have more eosinophilic cytoplasm. Okay. What are the other types of necrosis that you know, guys? Okay, just you can revise that. Now, basically, burns is a type of coagulative necrosis. It's caused by heat. Remember, heat is transferred from the source of heat to the body, to our body, you can say. So, scald is a burn which is caused by moist heat. Remember, if it is because of liquid or some moist heat, that is because of steam, you will call that as a scald. Scald is a type of burn, right? Because of moist heat. Burn never occurs at temperature less than 44 degrees centigrade. You need at least this much, 44 degrees centigrade to burn, right? So less than 44, you will not have a burn. But what is it if it's caused by extreme degrees of cold? That is frostbite. That is not burn. Burn is never caused by temperature below 44 degrees. Okay. What are the types of burns? You have thermal burns, electrical burns, chemical burns, and radiation. Electrical you can have because of DC or AC. Chemical burns can be acid or alkali. Remember, if you are burnt because of acid, don't pour alkali. And if you have burnt because of alkali, don't pour acid. It's not good. It's an exothermic reaction. Or look at what exactly happens when you get burnt. How is it going, people? Let us look at the pathophysiology of burns. Okay, so the exact mechanism they don't know. But what they are saying is when the capillary is there, the increased capillary permeability will be there. So from the capillaries, what will happen? All the fluid, it will leak from the intravascular space. From the intravascular space, the fluid will leak. Okay, so this is because of increased capillary permeability. Again, from here, the intravascular space, what is happening? Because of the capillary permeability is more, there is loss of protein. Okay, so there will be hypoproteinemia, that is less protein in the blood, right? Because of loss of protein from the intravascular space. Then all these capillaries, what will happen? Blockage is happening because of aggregates of cells and platelets. There is blockage of these vessels. So again, what will happen? There is blockage of the lymphatic ducts also, right? So there is a reduced clearance of fluid and protein from the interstitial space by the lymphatic ducts, again because of blockage, because of these platelet aggregates, fibrin clots, etc. Okay. Now, intracellular fluid accumulation. So what is happening? Everything is coming out of your blood vessels. Your lymphatic drainage is not happening, right? Lymphatic drainage is not happening. So everything is accumulating in the intrafluid space, right? Intracellular fluid accumulation is happening. Okay. So what is happening? The proteins also have come out, right? So there's increased osmotic pressure in the burned tissue. In the tissue, there is increased osmotic pressure. This will lead to, again, fluid accumulation. So there is intracellular fluid accumulation, remember, and from the intravascular space, all the fluid has come out. Okay. Increased evaporative water loss. Because of evaporation, there is water loss. Then myocardial function is depressed. The heart, the functioning of the heart is depressed. So here they are listing some permeability factors: histamine, prostaglandins, thromboxane, etc. Continuing this, they are saying that there is reduced immunoglobulin synthesis. Immunoglobulin means what? Antibodies, right? So less antibodies are being there. If there is inhalational injury, the person would have breathed in all these smoke and all that, right? So there can be glottic edema, necrotizing bronchitis, pneumonia, etc. Septic shock, infection will be there, right? Cross infection due to microorganisms, etc., etc. Endotoxins will be there. Finally, because of all this, there will be systemic inflammatory response syndrome and multi-organ failure. So finally, what will happen? The burns patient, what will happen finally? They try to explain what exactly is happening. So there will be microvascular changes, hypovolemia, low cardiac output, poor tissue perfusion. This much if you have understood. These are the 4 things they have mentioned. Finally, what is happening? Okay. Kidney, what will happen? It will try to reabsorb water as a compensatory mechanism. It will try to reabsorb sodium and water. There can be tubular necrosis, injury to kidney due to myoglobin. So let us say the patient, the person has been involved with, he's inhaling the smoke, etc. Right? So airway edema in burns due to inhalation, due to inhalation injury, direct injury because of hot air, smoke, inflammatory response can be there to burns, edema from the resuscitation fluid. So you will try to resuscitate with fluids from that itself. Edema is it? Okay. These people can have hoarseness, right? Progressive hoarseness of voice, tachypnea. That is what? Fast breathing, is it? People who have facial burns in them. Then bronchoscopy you will have to do. You can do endotracheal intubation in these people. You will check the oxygen with pulse oximetry. So basically, if there is all this edema, then you can do cricothyroidotomy. Here, guys, how is it going? Let us just look at one more thing here. They are saying that there is ebb and flow of burns. That is, something is less and then more, some less more. See here, low metabolism, here hypermetabolism. A cardiac output is decreased, and then high cardiac output. Then this is temperature is low, looks like, and here increased heat production. So there is, increasing and decreasing kind of a pattern here. See, so this is kind of what you can say as a fever or something, right? Now, what happens as a metabolic response to burn injury? Let us look at this. Guys, we are looking at metabolic response to burns injury. Okay, what happens if you are having a burn injury? What will be the metabolic response? So, gluconeogenesis and glycogenolysis. So, finally, glycogen will break down, glucose is created. The glucose levels will increase. Very good. Then fatty acids are released because lipolysis will happen. Everything is breaking down. Glycogen is breaking down. Lipids are breaking down. Proteins are breaking down. So, you will have amino acids also increased, right? So there will be increased production of urea, which is excreted into the urine. There is increased efflux of amino acids from the skeletal muscles, which will include alanine and glutamine. So amino acids will increase, fatty acids will increase, glucose will increase. So because of this, these patients will require more than 1 gram per day of protein. Okay, glutamine also can be given because they are see, there is increased efflux of glutamine, etc. from the skeletal muscle. Okay. So, catecholamines are massively elevated in burn injury. So, guys, did you understand this? So, more of glucose, more of amino acids, more of fatty acids, more of catecholamines. Catecholamines are massively elevated in burns injury. Shall we move on, people? Before that, guys, one question for you. What are catecholamines? Yes, catecholamines are dopamine, norepinephrine, epinephrine, adrenaline, basically. So basically, emergency care, how will you do? You will, is this where we are? Yeah, you will give 100% oxygen via non-breathing mask if the patient has unconscious endotracheal intubation, they are saying. And you will give ringer lactate via IV, right? 1 liter per hour in adult. So guys, just understand here, this is fluid resuscitation, right? Fluid you will give, and for whom? See, if the total burn surface area is greater than 15%, right? And then they have a risk of hypervolemia. So you will give them ringer lactate, okay? And how will you give? Veins of upper limb you will prefer over lower limb. For child, guys, you will give dextrose normal saline, okay? Dextrose, not just this ringer lactate. You have to give dextrose normal saline, glucose, right? Dextroses. And for child, if it's just greater than TBSA, 10% TBSA, that is total burn surface area or body surface area. Look at this interesting thing here, guys. If there is, as an emergency care, you have to remove the clothing and jewelry because the swelling begins, okay? So you should remove them. Guys, now let us look at the management. See, if it is anything very severe, you will have to refer them to a dedicated burn center. But let us say cold water bath you will give for these people. Cold water, don't give ice water, you will burn them more. So you will cause more injury, you can say. So basically, you will give them 15 degree centigrade water or tap water or saline water. You will at least give this, you will put it over the burns, right? For 10 minutes, you can do up to 1 hour, it will be effective. Okay, don't ice cold water, remember. Okay, then you'll take the history and then you'll hospitalize, etc. Air conditioning facility should be there. Assessment of the depth of burns, we'll come to this. Basically, if it is partial thickness burns, what will happen? The nerve endings are exposed, so there'll be a lot of pain. If it is a full thickness burn, the nerves will be destroyed and the people will have no pain. Interesting. Then coming to how do you assess this body surface area, you have the rule of 9, that is the rule of Wallace. Let's look at this. Let's only look at the adult one. So his head together, front and back together is 9. Chest is 9. Abdomen is 9. Upper back is 9. Lower back is 9. His right arm, the entire limb, right limb, upper limb is 9. Okay. And left upper limb is also completely 9. That means front is 4.5, back is 4.5. Then left leg or right leg front 9. Left leg front 9. Back of your leg 9. 9. Then what else? Genital area is 1. Okay. So you'll have to remember this. It's a very important question for your exam, guys. So head and neck 9, upper limb. So upper limb 9, 9, anterior trunk, that is your chest and abdomen 9, 9, posterior trunk, that is back, upper back and lower back 9, 9. Then lower limb will be 18, one limb will be 18, that is front 9, back 9 and 2 legs. Then genitalia, external genitalia, only external genitalia 1%. Okay. So management only they are talking, in that management they covered rule of Wallace. Okay. Then you will monitor the temperature, pulse, respiration, all this is your vitals you will monitor. Urinary catheter, indwelling urinary catheter, that's the police catheter you will introduce, right? And you will you will measure strictly the intake and the output. Why? Because output will tell you the tissue perfusion, urine output, right? So basically in adults it will be 1 ml per minute, isn't it? So then Ryle's tube is passed. This is your nasogastric tube, is it? Isn't this the tube? So they can develop acute stress ulcers. So these are called as acute peptic ulcers or curling ulcers. So to prevent bleeding, they are giving a cold stomach wash. Okay, that's why they are giving a Ryle's tube. Okay, antacids and hydrogen receptor blockers such as ranitidine. So basically to control your acidity, they are giving this. Okay, that's nice. So you learned something now. What did you learn, guys? Management of burns. What did you see? Here they are talking about Ryle's tube. So basically you want to do a stomach wash so that the person doesn't get those curling ulcers. Then what else did you see here? The management, urinary catheter, you will take a strict note of the input and output. You will monitor the vitals. You will, what else? Assess the depth of the burn, the body surface area. Then you will take history, admit the person, cold water bath. Okay, all these are management we're looking. So now you have to do that fluid resuscitation. How much fluid you need to give, that you need to know, right? So here basically you will give crystalloids like ringer lactate. They already told you this. How will you decide how much to give? In any patient with burns, about 20% red cells, packed red cells are also given. Okay, let's look at this. There is a Parkland formula, guys. Here, look at this Parkland formula. How will you do this? In this, you are giving only crystalloid. Crystalloids only you are supposed to give ringer lactate, isn't it? That's what they are telling so many times. So 4 ml into the percentage of burns, that is, you did that BSA, right? That one, and into the number of kgs of that person. Okay, so let us say a 55 kg person has around 30% burns. So how much should you give? 4 3s are 12. 120 into 55. I will need a calculator. Hold on. Around 6 liters, 6-11 liters, let's say. So let us say this person needs around 7 liter, let us say. So you should give half in the 8 hours. Okay. That is, you will give 3.5 liters in the first 8 hours. Then in the next 16 hours, you will give the remaining 3.5 liter. Okay. So this, what are you giving here? Ringer lactate. Guys, are you focusing? What are we giving? Ringer lactate, fluid resuscitation. Now you know the amount that you have to give based on the amount of burn, right? Which formula is it? Parkland formula. Very good. There is some ALTS guidelines, new one. Look at this, advanced trauma life support. Here, guys, the formula, whatever you just studied, actually applies only if it is an electrical injury. That 4 into the percentage into the TBSA. Actually, for the normal burns, which is not electrical, they are actually recommending 2 into percentage into kg. Guys, it's 2 into in the ALTS guideline. Guys, there is another formula, that is Brooke's formula. Here they are giving both crystalloid and colloid. So look at this. So they are giving crystalloid and colloid. Let's open this new one. Wait. So this is the brooke one, guys. Here they are giving 1.5 into the kg percentage thing, and colloid they are adding, right? 0.5 kg percentage. Are they dividing here? Oh, per. Okay. And there is something extra also in this brooke. Okay, not just crystalloid, colloid. They are also talking about free water. 2 liter of free water. So this brooke is giving what and all? This brooke guy. Let me just show you this. Brooke guy. He's giving crystalloid, colloid, and also free water. 3 things he's giving: crystalloid, colloid, free water. Crystalloid is all your ringer, lactate, and etc. Colloid will be your albumin, etc. Dextran, all those will be colloid. Look at this. Crystalloids will be your ringer, lactate, dextrose. All this only they were talking about so long, right? And colloid will be your albumin, dextran, gelatin, hydroxyethyl, etc. So to these people, they will not only give all these fluid resuscitation, they're also talking about giving broad spectrum antibiotics, which you will give against negative, positive, anaerobic, all organisms they want to give. Okay. So here they are talking about if there is next stage, they are talking about sepsis. If there is septic shock, they want to give cephalosporins. But otherwise, what do they want to give? Here they have mentioned higher antibiotics. They didn't tell what other antibiotics. Anyways, so do not give colloid in first 24 hours, something like this. They are saying, let's check. Are they saying here in the second 50 hours, they're talking about some maintenance, is it? Anyways, they're saying in the first 24 hours, you should not give colloid. For pain, for these people, they're giving morphine, pethidine, etc. And if veins are not visible, they'll have a cut down. A cut down needs to be done. Guys, there is one table here which is very important. Look at this. Degrees of burns. Okay, you have types of burns. You have seen different types of burns. There you saw electrical, chemical, thermal. What else did you see? Radiation, is it? All those burns you saw. Now we will look at degrees of burns. So basically, if only you in the skin, what and all, you have epidermis, then you have dermis, then you have subcutaneous fat, right? Then below this you can have muscle, etc. So if epidermis is involved, it is first degree burn. If dermis is involved, then you can have second degree. Third degree means subcutaneous fat is involved, and below that also it's involved, then it will be a fourth degree. So basically in this, where dermis is involved, you can have 2 types. You can have superficial or deep. So basically what will happen, in this only they were telling that if it is superficial, the nerves will be exposed, etc. The person will have pain. Deep means the nerves would have got damaged, so there will be no pain, which is very nice, kind of. So guys, here and when in the second degree burn, you will have blisters, okay? Blisters will be there. See, if it is only epidermis which is involved, you just have erythema, just redness you will have and some edema, right? But if there's blister, you can say it is second degree. Then if it is third degree means what? Third degree means entire dermis is involved, isn't it? So they will have this, no that needle prick pain sensation will be absent, okay, because all the nerves are destroyed. Guys, focus on the pain aspect here. They have a separate column for pain here. What they're saying here is pain is there in first degree. Pain is there if it is superficial, right, in the second degree. Pain is absent in the deep one, right? And obviously in the next one also, as the dermis is completely gone, there is no pain, okay. How does this heal? They are asking first degree. It will heal 3 to 5 days without scar. It will heal by itself. Just to 3 to 5 days, it will heal. Second degree, it will have some 10 to 20 days, but it will leave a scar. Hypertrophic scar will be there. In third degree, what will happen? Eschar, that black color thing, eschar will develop, okay. And it will take weeks healing. Eschar will separate. They will need some split skin graft, these people. So look at this first degree burn. Here you just have some redness and the epidermis is involved. The second degree burn, here it is a superficial kind of a thing, right? Partial thickness, you can say. So here this is second degree, and finally here they have shown you third degree burn. And they're showing some black eschar, is it? Subcutaneous fat also involved. So here they're showing you hypertrophic scar. Means where will this be? Second degree burn, hypertrophic scar. And look at these contractures. You can see the contractures here, how there are contractures. So these are, I'm guessing, third degree, isn't it? There's just very little left now, so we'll just go to the treatment, etc. There's treatment of burn wounds. So what will you do for the wound itself? Antiseptic agent, Savlon, iodine, they're saying. You can dressing, you can do open method or closed method. Open is where you're having exposure. right? If it's a face or something, or how will you do dressing, right? So basically here what will happen, because there is exposure, right? So there can be pain, or there can be heat loss, there can be cross contamination because it's an open thing, isn't it? And what will you do here? If it is a fumigated ward, so you can leave it open, so then there'll be no fear of contamination, looks like. And you will also apply silver sulfur diazine, which is an antimicrobial. But if closed method means what? You will apply silver sulfur diazine and silver nitrate or mefenide. Okay, all this you can apply, and on that you can put bandage. So these bandage, so many materials are there, absorptive, non-absorptive, etc. This is closed, right? So there'll be less pain, there'll be less infection, etc. The thing is, you'll have to change this bandage twice daily. Okay, twice daily you'll have to change. Okay. Yes, next technique is surgical. So look at this 3rd degree, 4th degree burn. Basically here they're talking about something like this: tangential excision of skin layers. Okay, parallel. What is this? The burn wound is excised tangentially till fresh bleeding occurs. So this is then they will follow it with skin grafting. Okay. So basically what this is treatment for circumferential deep 2nd and 3rd degree burns. Is it? This statement is kind of hanging. Anyways, tangential excision, what is the advantage? Basically it will prevent secondary infection and septicemia. It will decrease the stay of the hospital, because this eschar which has formed, right, it will take 2 to 5 weeks to separate. So here what they're doing, they're tangentially, they're excising till fresh bleeding occurs. They themselves are excising. And then they're putting skin graft, which they're taking from normal area or from a skin bank. This will decrease incidence of contractures and hypertrophic scar. The cost of the treatment also is reduced. So tangential excision is very, very nice, though the photo is gross, isn't it? Then, what are the causes of death in burns patients? Let's look at this. So, basically, there can be hypervolemic shock, because, you know, they are losing all the intravascular fluid, right? What are they saying? There can be refractive hypervolemia. Refractive hypervolemia can be there, is it? What is this? Then, there can be choking or suffocation because they had burns, right? The respiratory burns can be there. Okay, and septicemic shock is the most common cause of death. This is very important to know. Look at this table here. They are telling you how sepsis occurs in burns people. See, basically what happens, these people in the burn site, there can be infection, or the lungs, there can be infection. Catheters can cause infection, or the central line itself can cause infection, right? So they also have low immunity because they're immunosuppressed, because of cell-mediated immunity is lowered, and because of that there can be opportunistic infection leading to sepsis. The other things are because of microvascular damage, these people cannot absorb food. So there is failure of enteral feeding. So there's bacterial translocation which will lead to sepsis. And the most common organism you have to remember here, Pseudomonas. Then what will you give these people? Broad spectrum antibiotics. Look at this. Look for 6 P's. Pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia. All the septicemic shock they are saying. If these are present, it indicates compartment syndrome. You will have to do escharotomy. Okay. This is something to do with your 3rd degree burn, isn't it? Escharotomy you will have to do, because if there is compartment syndrome. Poikilothermia, something to do with thermal, right? Inability to regulate one's body temperature. What is paresthesia? Pins and needles, guys. Pins and needles sensation. Abnormal sensation. Pin, needle, sensation. Okay. So guys, did you understand? So basically, they're talking about compartment syndrome, escharotomy you have to do. Right? But why did they put here as a cause of death? I didn't understand. This textbook could have been written much better. Guys, we have reached the last heading in this chapter, in this part on burns prognosis. So basically, it depends on several factors. So if you don't treat the post burns, these people can have contracture, which you can see here. So guys, the factors which affect the outcome is the age of the person. If it is very young or very old, they'll have bad prognosis. The depth of the burn, we told you, 1st degree, 2nd degree, etc. Inhalation of these fumes can cause problem. Cardiopulmonary disease, if they have already some comorbidities, can have issue. Guys, when it comes to skin graft, there is something called as split skin graft and some full thickness graft. So if you want, you can look at more on the graft, okay? So if you want to do the skin graft, basically the infection should not be there from streptococcus or pseudomonas. It should be should be infection free. When are they doing all the skin graft? After that, tangential excision, remember. So guys, in this video, we looked at burns. Guys, in a burn, in the middle, whatever you have in the red, whatever they've shown here, that is zone of coagulation. Around it, you have the zone of stasis, and then around it, you have the zone of hyperemia. Okay. Just remember this much. In the middle, you have coagulation. That's what coagulative necrosis you have, right? Coagulation is there in the center. Then around it, you have the zone of stasis, and then here you have the zone of hyperemia around it. Guys, in splash injuries, splash burns, etc., you cannot get the exact body surface area, right? Total body surface area affected. So there is a rule of palm where you take the palm along with this finger area, right? That you can take as 1%, and then you can divide that, you can put a paper and measure that much and then divide it and check how much of burns are there. That is the rule of palms. What will ringer lactate have, guys? See, normal saline will have sodium chloride. That's it. But ringer lactate will have sodium chloride plus it will have potassium and calcium. Okay. And it will have a buffer of lactate. So lactate, ringer lactate. So you can see its pH is 6.5, which is more towards the neutral side, isn't it? Normal saline is more acidic, is it? So ringer lactate is what? It is a crystalloid. Guys, in exam, the questions they'll ask you is they'll ask you to define burns. They will ask you to classify burns. They will tell the pathophysiology. Can you explain of the burns? What exactly happens? The degrees of burns they will ask you. The area, how will you assess? That is the Wallace rule. All that you'll have to write. And so many other ways are there, right? You'll have to write that. Clinical features of burns you will have to explain. Then how do you manage a burns patient? Then what else they will ask you? This Wallace rule is very important. Fluid replacement, how will you do? That's what they will ask. Acid burns, they can ask you. Okay. That's all for now in this video. Bye bye.